Negotiations are underway on a measure that could radically reshape your hospital bills, but hospitals fear it might force them to cut back on services. News 8's government reporter Garrett Bergquist tells us what's on the table.
If you go to a doctor's office or a clinic that's affiliated with a hospital, chances are your bill includes additional hospital fees. Lawmakers are working on a measure that might change that. The measure's supporters estimate eliminating the extra fees could cut your hospital bills by as much as half.
If, for example, you're paying $75 for a physician office visit, maybe your primary care doctor office visit, but they're owned by a hospital system or a hospital in general, then what would happen is they would not only have the physician fee, but they would also tag on a hospital fee. That's really not fair. Those aren't hospitals. They're not open 24/7.
The measure is the centerpiece of a broader effort to lower health care costs. It's now much narrower than it was at the beginning of session. Right now, the billing language would only affect hospitals that generated at least $2 billion in net patient revenue in 2021. That's about 5 of the 39 hospitals which reported financial data that year.
When you're looking at a policy that singles some group out, no matter what that is, whether that's in healthcare or something else, I think we have to be very cautious with that. And so I have concerns with that element. We don't see that equal accountability for, let's say, the insurance industry or the pharmaceutical industry, for that matter.
The Indiana Hospital Association's Brian Tabor says lawmakers need to address the state's low Medicaid reimbursement rates. He says limiting fees might cause some hospitals to cut back on services.
If hospitals are hurt, they really are the backbone of the delivery system, and that could actually reduce access.
Sachdev says that's overstating things.
They have multiple different payers. So they have payers from Medicare. They have Medicare patients, I should say. And so Medicare is a payer, Medicaid is a payer, and then employers are a payer.
Once the House and Senate finalize the bill's language, they will have to hold a final up or down vote on it. At the State House, I'm Garrett Bergquist for WISH TV, wishtv.com, and like us on Facebook.